Georgia State University, as I mentioned earlier, had done several studies comparing our orthotics to other orthoses on the market. They put us head to head with the best orthotics that they had ever tested. And they write, this was presented at the National of the NATA in June of 2002. The goal of custom-molded orthotic intervention is to restore normal mechanics to the foot so that toe-off occurs at the first metatarsal head. The significant orthotic main effect for the medial forefoot region with a P of 0.006. The lower the P, the more significant the effect. Suggests that the sole orthotic may more effectively correct gait mechanics than the PAL orthotic. Medial forefoot peak pressures in the sole were 44 and 61% greater than the PAL initial to 6 weeks. In other words, when you first put on a sole support, it's 44% more effective at making a significant positive effect in the gait cycle than the best orthotic that they had ever tested at Georgia State. At 6 weeks, it's 61% better than the best. This is a quantum leap in technology. Look at their graphs. Sole supports, the best orthotic that they had tested to that point. To summarize the course, before I came along, foot orthotics were hard, flat things. They allowed the foot to completely pronate and collapse. Then they took the collapsed, pronated foot and tried to control it by tilting the ground 2 or 4 degrees. So you were walking along the peak of the roof. I came along and said, 2 or 4 degrees? Walk across the parking lot. Every step you take changes 2 or 4 degrees. Why not instead change the forefoot to rear foot relationship? Raise the arch, supinate the foot, make it a more functional foot, and hold it there by going in full contact with it and calibrating to the correct force and flexibility, and then changing the angulation of the anterior facet before you hit the ground, creating a dampening effect. That is a major shift in our paradigm. Sure, you can go ahead and continue using orthoses that are no better than prefabs. Or you can shift your paradigm to bring it in alignment with physics and engineering principles and in alignment with what you yourself observe every day. They concluded at Georgia State. The sole orthotic appeared to be more effective in attaining the goals of custom-molded orthotic intervention, which include decreased pressure on the lateral met heads and increased pressure on the first metatarsal head at toe-off.